So there's been an update to a horrible case I talked about several years ago on this app. There was a patient by the name of Jennifer Cleveland who passed away in Texas after receiving IV hydration therapy. After this horrible tragedy, it was determined that the person that was giving her the IV therapy had zero medical training, and they were ordering products to give as IV therapy from this doctor right here, whose name is Michael Gallagher. He was an anesthesiologist and was over 100 miles away from the med spa when the incident happened. Now, Jennifer was given IV hydration therapy that consisted of, I believe it was B-complex, vitamin C, B12, and mixed in TPN electrolytes. So Dr. Gallagher here lent out his medical license, which is unfortunately a common practice. And in the state of Texas at the time, non-medical professionals were able to do injectables under the direction of a medical director like this. And the woman who was the owner of the med spa ordered TPN electrolytes. Now, there was a lot of confusion about this at the time. People were like, why was she given TPN? That person didn't recognize what they were ordering, which is obviously a massive problem. Now, TPN electrolytes have a higher potassium level, and the cause of death on autopsy was undetermined, but we believe what happened is she was given a large dose of potassium too quickly, which put her into a fatal arrhythmia and took her life. So the medical director of this med spa, Michael Gallagher, no longer has a license to practice medicine in the state of Texas, and he has been charged with all of these things. Now, Amber Johnson, who was the owner of the med spa and who is not a medical professional at all, is also charged with all of these things. As they should be, because it's insane to me that someone with zero medical training and knowledge could prescribe and give prescription products without an order from a physician, and that a physician would lend their license out in such a dangerous way. Now, since this time, a Texas group called Texas 400, I believe, pushed very hard to have a law passed which went into effect last fall called Jennifer's Law. And this is a huge win for patient safety in Texas. So now the changes that this law has made is that every IV session has to be ordered or prescribed by a physician, a PA, or an NP. Only qualified medical professionals can administer the IV. So lay people can no longer do injectables in Texas, thank God. Even with a doctor that lent their license out, it's not allowed. And there's also stricter rules about physician supervision. So this, of course, was a massive tragedy, should have never happened. It is so amazing that Jennifer's husband, as well as this group of physicians in Texas, was able to get this law passed to keep patients safe. Although these things are commonly thought of as no big deal and they're not real medical procedures, this just proves to you cases like this that they are a big deal, that trained professionals are required to order the proper things and administer the proper things, and to have safety protocols in place so that if something happens, you have a trained medical professional on hand that knows how to do CPR and has all of the equipment available for an emergency. So again, rest in peace, Jennifer. I am so sorry again to your husband and your family for such a tragic loss, but thank you so much for fighting for the safety of patients.